talk about dosing. Okay, let's talk about dosing and concentrations. This has been a big thing that I've been seeing online. I've been seeing a lot of people talking about everything that is out there. Okay. First, okay, let me back up, answer some of these questions real quick, because I always get on tangents and don't answer questions, and then everybody thinks that this is a recording, which it's not. I am live. Okay, protein and water. So I did not touch on the water when I was just doing a tangent. Water is extremely important, but not just water, electrolytes. So on my scale, it gives retention, it gives hydration. I have found water by itself is not enough. Water will not hydrate an individual on our scale. You have to have the electrolytes. So what I tell people, 2 electrolytes, add in 2 electrolytes. Now, I don't like the pre-made waters with electrolytes. I actually like the packets of electrolytes, because I find if you do the packets, it actually increases the hydration better than the waters. And it's less expensive. And you can control the concentration and the flavor to what you like. So what I do is I get the Propel packets and I will put them in 32 ounces, because I don't like them in 16 ounces or 8 ounces, or, I don't like how concentrated that flavor is. So I put 1 Propel in this much water, and it works great and it tastes good. So you do what you want. Talk about split dosing, where we're talking about concentration, and we're going to talk about dosing in general. I am Angela. I am a nurse practitioner. I have a clinic in Medina, Ohio, and we're going to talk about the concentration of the GLPs. We're going to talk about dosing. We're going to talk about split dosing. And I want to explain this to everybody because it's extremely important. All right. So what we're going to do first is talk about concentration. So at my clinic, we do 5 milligram per 1 ml. What I have seen and why it comes so inexpensive online, you can get it from overseas, you can get it from gray market. What is happening is, when you see it for $49 starting price, or you see it for places like this, first of all, they're usually charging you a membership fee. They're charging contract fees. They might charge, like a monthly fee on top of that $49. Be careful. Read the contracts. So what I do is I charge a flat fee. I only charge you for the monthly, the flat. When you buy the medication, that's the fee. You have free consultations, all of that. It's free. That's free until you decide to buy medication. That's when you get charged. So our medication S is 5 milligrams per 1 ml. I have been seeing ridiculous concentrations. I've seen 1 milligram per 1 ml. I've seen, 0.5 milligram per 1 ml of S. What happens is, when you're getting that, people have been telling me, well, my medication's not working. I'm not feeling anything. I'm still having hunger and cravings. Well, if you think about it, if you have a cup this big and a cup this big, if I give you 0.5 milligrams or 0.5 mLs out of this cup versus a 0.5 milligram out of this cup, which cup's going to work better? So that is why the concentration really makes a difference, because you're going to have a much better result out of a cup with a higher concentration out of this cup versus this cup. So they're giving you a dose that is like giving you water. So you really need to listen or read and watch this. And a lot of times you don't know until you get that vial that you've paid for and you look at it and you're like, oh, well, and then a lot of times you don't understand because you're not medical. So what I do is I have people send me pictures and then I read it and I'm like, oh, that's why you don't have any results. So then on T, which is MJ and Z, what I'll do is I'll look at that. So ours is 20 milligrams out of 1 ml, which is the highest concentration typically available. So what I do is the same thing. So I have seen as low as 7 milligram per 1 ml. I don't think I've seen 5 milligram per 1 ml, but 7 milligram per 1 ml. I've seen 10 milligram per 1 ml and 14 milligram of 1 ml. 14 milligram of 1 ml is name brand. And then we have ours, which is 20 milligram of 1 ml. So again, you need to look at the labels. Yes, they, and it's all dosing. It's all, what they're giving you, what they're starting you out as, and it's pricing. Yes, it's very enticing to see tea for $149 a month versus $369 a month. So you have to be very, very careful. So you have to be very, very careful when you're looking at what you're getting. Okay. So when do you go up? When do you decide to increase your dose? This is very important. So there are providers out there. The insurance is bad about this too. So what the insurance is saying and what a lot of providers are saying, every 4 weeks, you have to increase. And when these medications came out, that was the rule. Every 4 weeks, you have to increase. That's not true. That is not the case. So I've been doing this for 4.5 years now. So we have been looking at all of the numbers. I've been on them for 4.5 years. I have had thousands of patients and I have been processing, all of this data and this information and concentrating all of this. And what we have found is, let's treat you. Let's treat the person. Let's treat the individual and see what they need and do what they need. And we have found if we keep you on the lowest dose possible for you, then we know how to treat you. And you are the most important person. So what we do is we don't move up the dose if you're not having any hunger and cravings. If you are feeling great at the lowest dose possible, which is what we do with every other medication that we treat people with. Every other medication, blood pressure, diabetes, kidney meds, everything that we treat out there in this world that I know of, we keep you on the lowest effective dose that is effective for you. We don't just increase every 4 weeks. Now, maybe a psych med, we might do that, but for every medical med that I've ever heard of, we keep you on the lowest effective dose for you. So we do that on these and you do great. You do fantastic. You don't have the side effects and you don't have any adverse effects. So why not keep you on the lowest dose possible? So that's what we do. And let me tell you, people are so much happier. We don't have the constipation. We don't have the nausea. We don't have the vomiting. And we have WL, which is fantastic. So it is so important that you just stay on that lowest dose that you are having the WL, because when you increase just for the fun of increasing, you have the side effects, the adverse effects, and we don't want that. Okay. So that's what's important is the dosing. All right. So split dosing. Somebody asked about that. So let's just throw that into this conversation. So split dosing, I've never really been a fan of it. The only reason that we do split dosing is if somebody by the end of the week, let me add this in. Okay. Split dosing. If somebody by the end of the week and they're doing everything that I've recommended is having increased hunger, or if they're having increased side effects or adverse effects. So what you do to prevent the hunger and cravings, again, increase protein. So if you're hitting the protein goals, then we throw in the calories. Maybe you're not getting enough calories. We check your calories. Then we will do split dosing if you're having the increased hunger by the end of the week. But you have to be careful, because if you ever go back to weekly dosing, we have to talk to your provider. Then so I'm not a huge fan of split dosing. I have to figure out why why you want to do split dosing. There are a couple pharmacies and a couple providers out there that really like split dosing. I'm not a huge fan of it. I think I have like one patient out of several hundred or, close to 1,000 people that do it, and I'm not a fan of it. Okay. So that is my thought processes on concentration, dosing, split dosing. So if you want more, just DM me and I can help you with that.